Good evening once again. This is Julius, and we want to continue with the second part of pathogenesis of Staphylococcus aureus. And I left it a little at the pathogenesis, so let's complete the pathogenesis. So we were discussing about the spread and the incidence rates that have been occurring globally, and it is estimated that there is an emerging concern about the increasing risk of methicillin-resistant Staphylococcus aureus that is affecting so many people, and it accounts for 50% of ICU or intensive care unit patients. And according to some data and research, it is further concluding that 20% of these patients die from complications of invasive methicillin-resistant Staphylococcus aureus while on admission in ICU. This raises questions of the potential risk factors, prompting global debates into trying to evaluate the threats further. Although the colonization was not some arguments existed, like in 2013, that methicillin-resistant Staphylococcus aureus colonization was not due to ICU admission, but rather healthcare contact and hospital settings and select comorbid conditions. The high rates of clonal spread has been linked to contaminated hospital services, medical equipment, and inadequate disinfection, allowing the bacteria to spread between patients, and this risk in healthcare workers, diabetic patients, intravenous drug users, and people living in care homes. So there is data that is found in the Center for Disease Control, and these are recommendations for community education, infection control in healthcare settings, disinfection protocols in hospitals and care homes, as well as antibiotic stewardship. We remember that especially the overprescription of antibiotics can lead to antibiotic resistance. There is a known gap on patient knowledge on infection prevention that has been highlighted by Cladderwood and others in 2013, indicating the need for more measures to identify the risk factors and reduce the incidence not only of Staphylococcus aureus but also other hospital-acquired infections. So let's continue with the diagnostic strategies. And early and accurate diagnosis of Staphylococcus aureus is really crucial in trying to eventually find the possible treatment option. And as we all know, the gold standard remains culture-based methods, and these culture-based methods involve collecting culture samples which